So, roll call. I'm here.
Leetta's here.
Kelly's here.
Okay, we're all here. Can I get an approval for the our March 11, 2025 meeting, please?
So
I'll,
moved.
I'll second.
Okay, all in favor?
Aye.
Aye. So before we go on, I have a little announcement. I received a text message that Lisa is not going to be joining us because she's sick. So if she's not here, then for the item number 6, the flock camera, we're not going to be talking about that today. That will be postponed to a later date. So,
Why can't we talk about it? Chair.
because she's the one that will that has most of the information that we need about how that was taken out of the budget. Because if I recall, the last time we were talking about this flood camera, the discussion was it in the budget or was it not in the budget? And that is why we have it as part of our agenda item today. So if she's not here,
I'd still like to talk about it with Chief Mason because he's here and he was the one who was part of the discussion how it came up at a coffee chat at a neighborhood.
well, I'd rather we set that aside because if we are talking, so again, going back on what Chief Mason said the last time, he went to this HOA meeting and he was asked a question about the floor camera, and he told them what from his personal view, what that is. And if I recall correctly, Chief Mason, please correct me if I'm wrong. You had told us that you told them that the city is not doing this. And then somewhere along the way, we started talking about, is it in the budget? Am I right, Chief Mason? Please jump in.
Okay. Can I apologize, Chair, can I interrupt for a second?
Yes, please.
The item is on the agenda, so I suggest that we move this conversation at least under that agenda item and decide
Okay.
how much of the conversation we want to have at that point.
Okay, thank you very much for correcting me. Okay, thank you. So on that note, we will move on to item number 4, which is the crisis response and the FD care program update. Fire department, please, Chief Hurley.
Chief Hurley's out right now with some family issues, so I can kind of start off. We do have Ariana here with our FD Cares program. As you may recall, we are currently partnering with Olympia Fire Department to participate in their CARES program, which is the Community Assistance, Referral, and Education Services. But I'm not going to take away all of Ariana's thunder, so I'll just pass it over to Ariana.
Thank you.
Hey, good morning, everyone. I won't take up too much of your time either. I just wanted to jump on here and introduce myself. So my name's Ariana, and I originally started with the department as an intern for the CARES program, and then just recently got hired on for the part-time position here in February. And since then, we've been able to provide services for 23 clients. I'm currently working with 11 as of right now. And I think our biggest success story so far has been that, you know, the caller that had the most calls last year, we've been working with him for about 4 months, and he's actually had a reduction in calls, about a 40% reduction. So that's been something pretty good to see so far. Yeah, so it's still kind of new in the works. We're still receiving new referrals slowly by the fire department, kind of just based off of how many people are kind of hearing about the process on how to refer. So yeah, it's going pretty good so far.
I could give a little more context as well. Thanks, Ariana. And like you said, you know, some of this takes a little bit of time for our crews to actually remember we currently have a program. So some of our members are real good about referring, and these things kind of go in waves too. So, you know, when our crews go out and see somebody that it depends on what they need. Maybe they need a referral to healthcare. Maybe they need some other services. And we do have Serena, who runs the CARES program overall as well, that can answer questions. But like I said, our crews are definitely getting used to it, and I anticipate that they're gonna just continue to do more referrals throughout this. And I do see Councilmember Dolan has a question.
Yeah, thanks, Chief. I'm just wondering, can you remind us, because I get there's so many programs, right? And sometimes they blend in together. So these are not calls that are coming in to 911 and then FD Cares is getting dispatched. These are non-calls, right?
Typically, they are calls that are coming through 911. We don't have them, and then what our crews tend to do, so they go out, see this, and these are for patients or residents that unfortunately we just don't have the resources to really address. We can obviously take care of the immediate need, right? But there's a lot of these customers need more services. So what our officers on scene tend to do is they can actually refer to FD Cares, which is Ariana and Serena, to actually go out and do a check. And I don't know if you want to fill that in, either Serena or Ariana, kind of on your end, what that looks like.
I can share a little bit about kind of our process if it's helpful.
Yes, please.
So when when a call is dispatched through 911 and the crews go out and they meet with an individual, oftentimes what they're called out for isn't the only need that individual might have, and so they might see something else that's putting them at a higher risk for further calls, further complications, poor health outcomes, poor living conditions, things like that. So that's when those referrals are made to CARES, and we kind of take a look at why they were referred. We do a screening with them as an initial point of contact, look at some domains that, of need, whether it be mental health, physical health, and then we identify some goals for the individuals and work on connecting them with local services within the community, mental health resources, medical resources, things like that. And the goal, obviously is to, well, not obviously, but in many cases is to kind of teach appropriate use of 911, but also improve health outcomes for people.
Thank you, Serena. So your goal is to get them the support and services they need, not just calling 911. Because sometimes you're seeing like maybe it's a senior who's isolated and it's really not about the 911 call, but actually there's some safety issues in the house, or they're not having access to food, or they're not taking their medicine. Like you see other things and you're doing the work behind the scenes to limit their calls on 911.
Yeah.
Okay.
Yeah, utilizing, 911, we did a really great job for so many years of telling people if they needed help to call 911, right? And so it's kind of the knee-jerk reaction for people when they don't have a primary care doctor, or they don't have awareness of what services are available in the community, and sometimes they just don't know who to ask. And so we come in and we're able to connect with people and maybe share a resource that they're already aware of, but figure out, how do we get them there? Do they need dial-a-lift? Do they need, is there something that can be of support in that way? But then the other side is oftentimes people just aren't aware of what resources are available. So we work really hard to get people connected, and then in turn, they're not using 911 as much because they have other options.
Right. I know back in the day, like Together used to have like that resource book. Do you all have like a list of like, oh, they have a pet. We can connect them to senior services or Meals on Wheels, or if they're, so you have, is that public? Do you list that anywhere? Like all those resources or nonprofits that are providing those services?
We don't have a public list at this point. Primarily, and Ariana can speak to this too, but we've been compiling a list for the last, year or so, and each time we're, searching for a new resource, we identify something that we maybe even don't, didn't have awareness of. We add it to our resource, I don't know, our folder that we have. But we haven't made it public because we really don't want it to appear that we're favoring one agency or resource or business over another. So until we can get a really robust list, we don't want to put that out like on our website or anything like that. But eventually that is the goal. And there are resource lists that we utilize that were created by other people too.
Right. Is there ever a point like when you're getting ready to publish it that council can review that? I know that we field a lot of questions as well. And so like I know I have my list, right? And I serve on some boards. Is there an opportunity when it's getting ready to go public for council to review?
We won't ever make anything public without getting permission. So yes, if it's attached to any, Olympia Fire or Tumwater Fire in any way, we always make sure we have permission before we publish anything. So it's, I think it'll be a little while, but yes, the answer is yes.
Perfect. Thank you. I just know that when you have that ready to go, it also helps council in Olympia and Tumwater when things come in. So that messaging and that consistency and that branding, we would like to support you being successful. So thank you, Serena. I appreciate that.
So you may have mentioned this, I'm not sure, but I need to verify. So is your services only for Tumwater residents or people in Thurston County in general?
As far as the Tumwater contract, we're serving the people that are served by the Tumwater Fire Department. Olympia Fire, we have a program also, and we serve the people that are being served under the Olympia Fire Department. So it's not a countywide program at this time.
Okay, thank you.
Yeah, and
One
part
more-
of that is that I will say, so Ariana is our Tumwater person. She actually comes to the station here at Station T1, the headquarters fire station, and she serves several days a week. So she's the part-time for the city of Tumwater.
Is the goal to make Ariana full-time? Like we're doing this program now, is the goal to expand it so there's more coverage and more service?
Yeah, I'll go and answer that. Sure, why not? Some of it's always budgetary, right? And honestly, and I've talked about this even going back to my previous days as the medical services officer it also is need. And to be honest, our volume is different than Olympia Fire Department or the city of Olympia or even Lacey Fire. So really that halftime is right now that sweet spot where we're keeping Ariana, I think, busy enough on some days and maybe not busy enough on others. So certainly I think as we roll this out this year and even next year and Serena is able to have a little more data, that's a conversation we can have moving forward. Yeah.
Perfect. Thanks, Chief.
Yep.
All right. Would that be the end of the presentation?
I'm good unless there's anything else you want to add, Ariana or Serena.
Nope. Thanks for having me here today, guys. Thanks.
Thank you guys very much for presenting this morning. On that note, we will move to Thurston County District Court update. The Executive Department.
Councilmember Agabi, I believe we were going to talk about the crisis part as well. And we do have, so this is a different program that currently Olympic Health and Recovery are working on, and I know Joe is popping on right now because I don't know a lot about this one, so I'm gonna go right to Joe.
One second. So
Yeah.
for this presentation, we were actually going to be talking about crisis response and the FD Care program update.
Yep. So we did the FD Cares. That's what that
Okay.
was. This is the crisis response,
Okay.
which is a different program. Correct. Yeah.
Okay.
Yeah. Thank you. Sir.
All right. Okay.
Thank you, sir. Thank you all. Good morning. My name is Joe Avalos. I'm the Executive Director for Olympic Health and Recovery Services. And you may remember I presented to you all, I think in October of 2024, regarding House Bill 1134 that was passed in 2023 to enhance the behavioral health crisis response system in Washington State. This aligns with the 988 legislation and the move toward the state's vision of having someone to call someone to respond, and somewhere to go for individuals that are in behavioral health crisis. First step of that was the 988 transition, and that's happening now. 988 is active and running, and I think in the Thurston Mason region, which is our overall region, they get about 500 calls per month. So it still hasn't taken off fully as they intend, but I think it has increased a little bit. But part of that was to establish someone to respond, and that was the mobile rapid response crisis teams. And that's a traditional mobile crisis team that we do here in Olympic Health and Recovery Services, but also a community-based crisis team, and that is the CBCT. And that's what I spoke about last October. And this is a partnership between a licensed behavioral health agency, which we are at OHRS, Olympic Health, and Tumwater Fire. So we entered that application through the Healthcare Authority earlier this year. And at this point, we have been told that we have preliminary or conditional approval for that, pending an on-site, a virtual on-site that is occurring next week. And so we fully anticipate that is going to go well. There were only 2 CBCTs that applied. It was our partnership. Sure, go
Joe,
ahead.
can I ask a question, please? So when you said your application received a conditional approval, from whom was that approval given, and how is that different? I know you're getting to the difference between your last presentation in October. Please focus on the difference about this particular application and what this one does. Thank you.
As compared to the FD Cares, or as
No, as compared to your October.
Sure. So the update then is that at the time in October we had not applied, and so we have applied since then and have been approved by the Healthcare Authority. The Healthcare Authority is the state agency that is funding and overseeing this partnership, and so they would fully fund this program, which is very similar to the teams that we have embedded with the Thurston County Sheriff's Department, the Lacey Police Department, and the Mason County Sheriff's Department. So it looks like a crisis clinician paired with a certified crisis peer. So it's a team of 2 that respond to behavioral health crisis calls that either come through 911 or through 988 or through the regional crisis line that exists in Thurston Mason County, specifically within the Tumwater city limits. That's the main focus. Although the overall crisis program is available to every Thurston and Mason County resident, this particular CBCT will focus on Tumwater. And I know Chief Crimmins talked about volume. I think what we found with Lacey, with Thurston County, and actually even with Mason County, it certainly was one of those, if you build it, they will come type programs. Initially, it was kind of slow, and then when folks started to hear about that this was available, then we started to get a ton of calls. And actually, right now, I believe the Mason County program is the highest volume, and that is one of our smallest. Obviously it's a pretty small county. And the other difference with this team is that they will be able to transport. We don't have any teams right now that can transport, so this team will be able to transport individuals who are voluntary and need to go to any kind of service, whether that's an appointment or to. A lot of times, our folks might need to go to a voluntary inpatient, like South Sound or something like that, and this team would be able to transport voluntary folks into that or to that resource.
Hey, Joe. Hi, Frankie. Nice to see you. So what's the timeline? So you got approved.
Yep.
What's the timeline?
So the timeline, so we have the on-site next week, and then assuming all that goes well, the contract between the Healthcare Authority and our organization would be in July. And so then the actual startup time with hiring and onboarding is probably going to be 90 days post that. We are actually looking at our staff now and seeing who might be appropriate to do that. We'd love to do that sooner than 90 days. But there still is the most important part, quite honestly, is just the integration between our staff and your staff, and learning, what they can and can't do, establishing those dispatch protocols, and then just getting used to having this resource that is actually quite beneficial to both of our organizations. So.
Right. And then that's the overlap with FD Cares, right? When Ariana or Serena have something like, oh, now we can contact Joe.
Yep.
Awesome.
Absolutely.
So it's a more holistic of approach, and we're providing additional services to meet the ever evolving needs of our community.
Correct. And many times they can respond, actually most of the time they respond without first responders, without law enforcement. It's only if there's something that is, beyond their scope that they would need assistance. And so I imagine that there would also be, of course, a partnership with Tumwater PD as well. Because there are some cases where folks are in crisis that need, additional assistance. Sure.
And when you gave your other examples, they are connected with the police departments or the sheriff departments. Why is Tumwater? Why is it with our fire department? Is there something?
Yes. So specifically for the endorsed teams, the CBC, community-based crisis teams, it actually excludes law enforcement. And that's something we hope to change in legislation next year. That I still to this day don't understand why law enforcement was specifically excluded. But that's something we'll work on. It was just, that's how the bill was written.
Yeah. Thanks, Joe.
Mm-hmm.
So I think that's it. I think just the update that we're conditional approval and on site next week, and then we'll go from there. But I'm happy to answer any questions you might have.
One thing, Chair, is I love this update. And if we could do this quarterly, like we do with our others, that would be great, right? Because as we see the need and see how we're responding, then for us on public health and safety, it would make sense if we need to do some budget adjustments, right? If they need more, if they need something different, for us to be better informed, and then to tell council, like, heads up, this could be coming. So I would appreciate quarterly updates so that we make sure that we help you be successful, both of you. So please, when there's things that you're seeing, any kerfluffles or like, hey, this would help, and if it's budgetary issues, I would love for you to help us stay informed so we can meet your needs.
And to top that up, I think this is actually a service that is needed, which is why I ask you to please differentiate between what happened in October and what you're talking about now. So this is good news, given the lot of cases that my wife is a mental health nurse. So I hear what's going on in Thurston County. So with these kind of services, it wouldn't be just Tumwater focused. It would be something that helps everybody in our local area. So thank you very much.
Absolutely.
So on that note, I get it that Joe is done then, right? And do we have any question? No? Thank you, Joe. Have a great day.
Thank you.
So now to correct my mistake, we're going to go back to Thurston County District Court update that I was alluding to before I was corrected.
Hey, good morning. Good seeing everybody. My name is Frankie. I'm the Court Executive Officer for the District Court. It's always wonderful to be here. I think it's been about a year since I've jumped on, so happy to provide any updates. And I was hoping to do this a little bit backwards this time, because I wanted to find out what y'all's questions may be, what information you may want about the courts, just because we've been having the conversations about our programs. I'm happy to go through the stats and kind of where we're at with everything, even with our mental health and veterans court and any of the programs that we provided. But I wanted to open it up if there's any burning questions or anything just about the services. It's been 11 years now that District Court has been providing services for Tumwater, and that's going to be the misdemeanors, gross misdemeanors, and civil infractions. So I wanted to open that up, kind of reverse the roles a little bit.
Frankie, I have some questions. One is the legislative updates of the numbers, like the attorneys, right? That the caseload and how many we had heard from our city attorney Karen, like there's some pretty substantial changes in need. And so how is your level of service in meeting those requirements, and also with the city of Olympia looking to contract out, what impact would that potentially have, or would that help getting more attorneys to be able to cover everything?
So as far as the city of Olympia, yes, the conversations are happening right now between city and county and developing what that contract looks like. From my understanding of what that looks like, there wouldn't be any attorney changes here within the county. The intent would be to have those services remain contracted by the city themselves, similar to our contract with City of Lacey. So there wouldn't be any impacts there. But you raise a very valid point as far as what the service level is generally between the entire justice system, if you will, including the attorneys and the courts. Because right now, everybody is short, and with the legislator coming in and not giving as much money as was hoped, it's more. But it's not as much as was hoped. That's something that is currently a conversation between Patrick O'Connor's office and county manager. So what that looks like for us is we're kind of balancing multiple things all at the same time. So it's not just the attorney piece. What we're doing is we're looking at our case flow management, how we can best support not only the cases that are coming through the court, but the attorneys that are providing those services for the defendants, for the city, for the state. So we're trying to find efficiencies there. The thing is beyond just that, we're also seeing that the case filings and proceeding counts, they're going back up drastically. Over the last 5 years, there's been a lot of changes. I say drastically, I say that generally. For City of Tumwater, yes, there's an increase. It's not as much of an increase as we're seeing with other jurisdictions, which is nice. I think it represents Tumwater well, because you can see there's 50–60% increase in certain case types like DUIs just between 23 and 24. But when you look at that holistically, you're still looking at like a 20% decrease from 2019 to 2024. So it's not that we're exceeding where the old numbers were, but it's that steep rise generally that we're seeing amongst all of our jurisdictions. Our proceeding counts here at the court generally, I'm speaking for all of our jurisdictions, has gone up from about 45,000 proceedings in a single year up to about 65,000 proceedings in a single year. And that's just over the last year and a half. So we've had quite a bit of an increase just in the case filings and everything coming through. So like I said, what we're looking at is how we can build efficiencies to better support the attorneys. We're looking at the docket types where we can provide some relief to the attorneys. One of those is like our non-compliance docket. If somebody does have a condition ordered by the court that they may not have had time to complete, judge orders victim impact panel. It's been 30 days. They haven't had that completed yet. What we're doing is we're addressing that more administratively, still with the judge, but without the need of an attorney to be present unless there is a violation found, so that we can free up some of their time. So I know it's getting a little bit more technical, but what we're trying to do is find efficiencies to relieve some of those stressors so that we can still provide the best service that we can given the situation that we're in.
Thank you, Frankie. So last 2 weeks, there has been in local news about the municipal court being transferred and that building being sold. Would that have any bearing on caseload and services?
Oh, absolutely. Yeah, it would have impact on that. The thing is with how that works, similar to when we contracted with Tumwater 11 years ago, what we end up doing is the cities end up reaching out to the county, say, hey, we want to explore what this option looks like. My role within that is to say, what would the resources be in order to support that without impacting the other contracted jurisdictions or the services that we provide. So that's what we end up sending over to them. My whole intent with any process like this is to not impact the services that we're providing to others, if anything, to increase that service level. That is the bare minimum for every conversation we have. So there's not going to be any negative impact if those contracts do proceed to City of Tumwater, City of Lacey, City of Rainier, or to the county in general, as far as the services that we provide. There won't be any negative fallout from that. We are going to be able to provide the same level of service, and those resources would be able to support that.
Thank you.
Chair, can I say something real quick?
Sure, please.
I just wanted to tell Frankie and you how much we appreciate the work they do for us and the court. I don't know if many of you were around when we used to actually support municipal court here. And it was, even though it was not the purview specifically of the police department, it was very challenging to city operations. And we were not able to provide any of the therapeutic services that they currently provide through the district court system. And I think it's one of those partnerships that I think has tremendous value for both sides of the equation. I think we probably get the better deal out of it, and the people that are our community members. But I do thank Frankie for what he and his staff do to support all of the criminal justice operations. And beyond that, it's just about community operations.
I appreciate that. Absolutely agree. Partnership's been fabulous. And the therapeutic options and everything we've really appreciated too. We've had some transitions within the Department for Mental Health and Veterans Court, but these have been very positive. We've had Alex has still been she's our program manager right now. I think I introduced her last year, and we have 2 new staff within that program that are re-looking at how the structure of the program works, how we're supporting all the participants that come through. We're always looking at ways to change, ways to adapt, ways to be flexible, and supporting everybody that comes into the courts where they are. We've even pretty excited about this. We've even recently gotten funding through the Administrative Office of the Courts to support equine therapy cohorts. So for those who don't know, it's a really wonderful therapeutic approach in addition to what services we're already providing, where we can send participants to go work with horses basically in a therapeutic environment. And there has just been really, really positive impacts from this program, and we're super excited to stand that up. We actually had our first cohort start here last week. And then we'll have another one here starting next week as well, and we're hoping to keep that going. So we've had a lot of great changes happening within there. Kelly.
Hi, Frankie. Good to see you.
You know.
So I'm on lead for Tumwater. I represent Tumwater on lead, and I'm just wondering, how are programs like that affecting your work? Like, are there cases you're not seeing because of diversions? Are you tracking that? How is Tumwater doing?
That one, I don't have the exact numbers on what that looks like, because in most situations, fortunately, those are going to be intercept before a case gets filed with the district court. Now, we're still reaching out because LEAD is just so fabulous. We still reach out in certain situations, even with Mental Health and Veterans Court. Sometimes there'll be somebody that's already engaged with LEAD. So we'll work with them and have conversations about what resources are being provided, make sure that we're not double doing efforts and we're really leveraging each other on how we can support people going through. So there are some situations that we're going to work with them there. But fortunately, with how that program's designed, it'll intercept before they end up becoming justice involved.
Right, thank you.
Absolutely.
Ricky, I just have one more. I know I was talking to Thurston County Commissioner Mejia about the homeless court. Is the discussion about that? Like, could you talk about the different types of programs you have
Oh,
again?
definitely. Yeah, so we have the mental health and veterans court. We have our mental health probation. So what that is another way to provide extended services through the post disposition. After somebody has been found guilty of a misdemeanor, gross misdemeanor, we can provide the same level of therapeutic support and resources through our probation. We also have our substance monitoring program. That is still funded in effect. Contracts go through to the end of 2026, where we provide all SCRAM urinalysis testing free of cost to indigent defendants. We have pretrial services through the county, similar to probation, but in that kind of predisposition status. And there is the Thurston County Court Alternative Program. That's the homeless court model. So a couple representatives from the county ended up going down to California to look at what they called homeless court. They saw some opportunity within that and brought that back to the county here and established what would this look like. So that Thurston County Court Alternative Program, TCAP they call it, it's still a little bit in its infancy and trying to find out how that can best serve all of our community members. But what the intent of that is for some of those lower level offenses that may not otherwise qualify for any of our other programs, there's still opportunity there by which the attorney and prosecutor can say, hey, this person can really use some resources. Let's send them through this program. They'll get in contact with our Thurston County Resource Hub. They can connect them with a case manager that can identify, do an assessment, identify, okay, there's housing concerns here, or there may be some mental health or substance use. Let's find the programs for them, get them involved in treatment. And as long as they work with their case manager, they engage with those services, then there's an opportunity for that to come back to the court and those charges to be dismissed. So a lot of those we can see with criminal trespass, theft charges, things like that, that we can provide some initial services. It's voluntary, but given that situation and the opportunity for a 6-month program to, hey, engage, get those resources, have yourself set up for not only the court and getting your charges dismissed, but set up for those in the future is a real great opportunity.
I don't think a lot of people realize, that's those who are experiencing houselessness or find themselves without safe shelter. It is a very energized conversation with our community members, right? It's the whole entire spectrum of thoughts and feelings. And I don't think a lot of people realize how Thurston County is taking these issues and developing and implementing solutions. And I love the solution because it also identifies accountability, right? So you're helping people be the best version of themselves, right? And also setting expectations and managing expectations. So I think this could be a game changer for our community because if you're committing a crime and it impacts all of us, right? So when we talk about our jurisdictions, this is an example of that larger approach with the county because we have people who are committing crimes in multiple jurisdictions, right? And that overlap. And so having this larger approach, I think, is going to be really, really beneficial to Tumwater, everyone who has that touch point. So thank you, Ricky, for giving that update.
Oh, absolutely. And I think it's just like you said, it's a wonderful opportunity because it's looking at why people are justice involved. And it's providing those resources early on in the process. Because to be honest, in most situations, there are the ones that somebody just makes a mistake. They have their first DUI, they shouldn't have been doing it. But there's a lot of other situations by which people are just in a bad place. They don't have the financial capability to keep up with things. There's stress, there's mental health, substance use issues, there's homelessness, even the ability to pay for childcare or maintain a job. So being able to identify those early on, provide those resources, get them on the right track, that's going to be much more effective than just sending somebody through the criminal justice process beginning to end over and over again. So it's really an opportunity to start identifying those pressure points within these programs, and which is why we're looking at different opportunities, even within mental health and veterans court, within probation and mental health probation. How are those services going to meet them where they are to provide the resources that can be successful in the future? So that covers all the programs. We're still looking at ways that we can continue to provide more clear, open, transparent access to the courts. We're still have our Zoom ability for people to appear for court. Huge drop in warrants. It's a similar thing because people are trying to maintain jobs. They can't take an entire day off or a half a day off to come in for a court proceeding. Now they can Zoom in at their calendar time and be there for 10 minutes, and we can get that matter addressed moving through without them having to find childcare or have any issues with their employment. So that's been wonderful. We're still live streaming all of our proceedings. If anybody wants to, you can jump on our YouTube. You can watch a docket here starting in 20 minutes. We still have all of that going through. We're very excited also. At the beginning of this year, we expanded our text notification suite, if you'll call it that. Thurston County District Court, we're the first court in the state to implement text notice reminders for court dates back in 2018, 2019. And we expanded that to basically when you come in for after your first proceeding, you're going to get a text message. It's going to be kind of that, welcome to Thurston County District Court. Here's the contact information. If you have any questions, any issues that come up, here's how to get a hold of us. They still get their hearing notifications. If there is any conditions that are ordered by the judge, hey, make sure that you get this class done by this date. We're going to send out text notifications. Hey, you got 30 days. We haven't received anything yet. 15 days, haven't received anything yet. Here's how to submit it all once it's ready to go. And then once they've resolved their case, they'll get the information. Here's how you can access all of your documents. And if you have any questions, get a hold of us. And we also have an opportunity too, if there's any drastic changes, it's an inclement weather text, but if there's anything that changes as far as, hey, your courtroom's been moved or court's going to be in-person services are canceled because of snow, but we're still going to have virtual options, we can send notification to them that has all that information. So we've been excited to be able to expand those opportunities as well.
Good news. So what do you think, or do you think it would be a good idea for the courts to have a youth program? And I'm asking because I have youth that are graduating from school, and this is summers around the corner, and they're all doing stupid things and not thinking. So, do you think that would be a good idea, or is it even possible?
You mean like another, you said, substance use program?
Yes, something similar to that, or it could be anything, even driving, or even whatever that may be, just to keep them out of the criminal justice system.
Yeah, and we've been looking at different programs within that, and that's the interesting part is the keeping them out of the criminal justice system. So there are those other intercepts outside of the courts that people can get those services, but for our service and our capacity, they have to have a case filed with the court before we can provide any level of service. But we're looking at how we can expand those, even as far as like the substance use piece. What we've been doing is we have our mental health probation, that more specialized and intensive supervision where they're right there with the client, working through all the issues with them. And what we did is we brought in more substance use into that caseload. So there's like deferred prosecutions, which is a 5-year program for DUI offenses, by which those are being brought under that mental health intensive supervision substance use program modality. So we're providing the extended services there. And we're also looking at expanding into providing our own internal victim impact panels and our domestic violence MRT programs too. So those are still kind of works in progress, but we're still looking at how we can further expand services to, again, meet everybody where they're at make sure that we're providing the services to ensure that they're successful even beyond their time here with the court.
Thank you.
I feel like that was a lot of information, and I didn't have to get too deep into the stats and everything.
Thank you. Do we have any more questions for Frankie? No? Well, thank you, Frankie. This is very, very good news. At least I was able to grab something from the presentation. You have a good day.
Wonderful. Thanks so much. It was good seeing you all.
Thank you. So we're back to item number 6, and this is the flock camera process discussion. So as I was saying at the very onset, since Lisa is not here, and it's my belief that she was when I was going to cue us in on the budgetary process, which is what I think we have, the reason why we have this on our agenda for today. So
Yeah, I mean, Chair, I'm happy to like clarify my questions for Chief Mason to follow up with Administrator Parks. The one
Okay.
question is, if this happens in the future where someone is assigned something like Administrator Parks, does Kelly take her place? Like, is there an alternate? Right? So that's a future question. The second one is when we had that discussion about Flock, and Chief Mason stating we're not moving forward, there's more discussion needed, right? And then Administrator Parks said, well, it's in our budget. And then circle back. And so the clarifying question is, when will we receive the comprehensive final budget that was passed in December? We received some screenshots, some documents from Troy. As always, thank you, Troy. And then I looked through those, and Flock is not specifically called out. So they're still working on those pieces. So the question is, what is the timeline to receive the final biennium budget that we voted on in December? Because it's May. For us to be better informed and well informed and to move forward together, I need the budget. I need to know where Flock is or where Flock isn't. And I see Troy. So just that timeline of, it was stated that we put it in the budget, but I don't see it in the budget. Those are the clarifying questions that we had, Chair.
Okay. So Troy, can you help me out?
I can help a little bit. Yeah, so when we talk about the budget, a few things. So we have sent out basically a complete budget, but I think the challenge is and before I move on, let me say we are working on the full budget book like we did. We haven't done that we skipped that for 2 bienniums. We're doing that this year, and we've got 4 people working on it right now as we speak. So you've got you've received some high level budgets, kind of higher level summaries. You've received a very detailed line item budget. I think the challenge is that in the line item budget, there's not a line that just says Flock, and so it is hard to see. So within the police budget, there'll be like a professional services contract. So it's kind of mixed in there with other things. What we're working on at the moment, also in addition to the full budget book, and I think it's just about done, is the schedules. So schedules that you would normally receive in the mayor's proposed budget, schedules A through I, which it has an Excel spreadsheet for professional services, one for staffing, a whole bunch of different big expense categories. So that's where you can actually dig in and see Flock in the budget, and those should be ready to be sent out to you this week. I think we've had Brittany going through and formatting those, making sure they fit properly so they don't, print out all weird and funky. And those I believe will be ready to send out this week to you. And then hopefully the budget book is big. So I'm hoping maybe in 2 or 3 weeks we'll have that out to you as well.
Awesome. Thank you, Troy. So that's the challenge is I get a comment from a constituent that attended the HOA meeting with Chief Mason. And I'm like, Flock's not in the budget because I don't see it, right? But then told that it was in the budget. And then I get documents, but it's still not in the budget. But being told it is in the budget, well then how do I know, right? So that's the challenge is we field a lot of questions, right? And that is my Bible for everything that's happening, right? When we've talked about the Equity Commission, I know that we've allocated 32 hours in the biennium for an Equity Commission, right? So that's how I answer questions to show where we're at. And that's why I've been so persistent to get something because I don't know the answers myself. So then I get frustrated that I don't have it. And then it comes across as not transparent, which is not the case, and that's not happening. But if I keep having to tell people, I don't know, like I should know, right? So that's why I keep putting pressure, and I get it, and I understand that. But we're having so many discussions about Flock, and I still don't know if it's in the budget. I'm told it's in the budget, but I don't see it in the budget. And so this is just good reminder for all of us of like, help cancel, help you. So it's not personal, Troy, and you and your staff are always amazing. It's just that I have so many unanswered questions and I feel like I'm not as well prepared as I like to be.
Yeah, that's understandable. And yeah, we thank you for that. We appreciate, your patience, and we'll get that to you as soon as we can. And I think, yeah, I won't make excuses or talk about why it's so late, but we'll get it to you as quick as we can. And I totally get what you're saying about needing, obviously you need to know those answers so you can answer questions. And so
thank you, Troy. I appreciate
that.
it.
Yeah.
That
Thank
was
you,
it,
Troy.
Chair. That was all
So-
that I had about Flock.
So just to be clear, my talk about postponement of the flood camera process discussion is incorrect because as we've just had, this process, the discussion itself haven't had, and Troy is going to be providing the schedule, well, the schedule process that go with the budget that will show what exactly is in there, right?
Right. Because the question is, we have unanswered policy impact questions regarding
Okay.
if Flock was going to be initiated, right? Public health and safety had questions. I think it needs to come back to public health and safety with a draft policy and then deciding if it goes to the full council, right? The question is, how long is the data retained? Who has access to the data? And there's draft policies out there. Olympia has Flock, right? It was at the ACLU had some draft policies, right? So there are unanswered questions. So if Flock is in our budget, what is the timeline, which Troy's budget will show us where it's at? And then when will a draft policy be submitted to public health and safety? Those are the unanswered questions.
Okay, so now let me restate that. So the discussion has been had. The process by which we will have Flock in Tumwater is not part of this discussion. That is going to be something that we will talk about when we find out if the flood camera system is in the budget. Right?
Yes,
Okay, correct. So, okay, correct.
you
So,
got it, Chair. You got it.
yeah, I wanted to make sure that our record reflects the accurate discussion that we're having right now so that we're not going to go back to what we had before that led to this confusion. So thank you very much, Leah, and thank you, Troy, for being here.
So more to come, Chair. That's where we're at. More to come.
Correct. So now we're down to item number 7, which is the additional items. I don't have any.
Kelly
Leah,
does.
you have any?
I do.
Okay, go ahead.
I'd asked in January that the policy for our police with regard to ICE, I'd asked that it be posted, and then Lisa had said she'd take it under consideration. And then in a follow-up discussion, she said it had to go back to council. So I would like for that to go to council where we just have somewhere on the website or on social media. We have community members who are concerned. At an equity symposium over the weekend, we had leaders who happen to be people of color who mentioned that they don't feel welcome in Tumwater. So I just feel like this is a policy. If I put in a public records request, I could get the policy. I would like for, Lisa said that council had to decide, so I would like for that to go to council.
So, please, humor me, please. So you were asking that the city manager made available our city's policy regarding is it regarding to the immigration issue, or just anything that borders on that in general?
Just how our local police department, the Tumwater Police Department, what our policy is, because I know that there is one with regard to federal agencies.
I'd like to
Okay.
clarify that. I see Karen. I'd like Chief Mason to circle back with City Administrator Parks regarding the resolution we passed in 2017, 2018 to look about a joint statement. And Karen's unmuted, so I'm going to stop talking.
Oh, I just wanted to say, in case you didn't know, that the policy of the police department is posted on our website, and it's under the police department's FAQ section.
I think we need a little bit more than that in this time is all. That I just a little more. So people don't have to go searching for it.
You mean more on the website, or you mean in terms
Like
of
social media, like a statement that
okay.
could be posted on the website, social media platforms. A statement like past Chief Wicks did in the past of what our police have done, what our police are doing, what our police will continue to do, and it's not engage with ICE, period. Here's the policy. This is what we have done. This is what we will continue to do. To make a public statement, I think that's what Kelly is talking about, and that's what I would like a recommendation from Public Health and Safety for that to go to council to discuss a statement coming from our city or police chief.
Yes, that more eloquently said, Councilmember Dahlhoff. That is what I was.
It's really, there's a lot of stuff going on, right? And so what Kelly, with her background in PR, has drilled into my head is setting expectations and managing expectations. We have a new chief. He's been here forever. He loves Tumwater. He's engaged in Tumwater. So I would like Public Health and Safety to put forward a recommendation to have council really talk about where Tumwater is going, what we will do, what we don't do, right? Period. And to hear from our chief and our mayor. Right. I know some people are more risk averse and less risk averse, and I know this could be uncomfortable. And I'm asking for Public Health and Safety to push something forward to council to have a discussion.
okay.
That's it.
Okay, well, we can certainly make that an agenda item.
Thank you.
Thank you both. Thank you, Chief.
So on that note, any other issue? So I don't have any, and I get we are not having a city work session tonight. So I would say you guys have a great day, and thank you for joining us this morning.
Bye.
Bye-bye.